Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look into the functions of the hypothalamus. So hypothalamus, and let's look at the functions. So first is what about the ventromedial? Ventromedial is associated with the satiety. Then comes the arcuate. The arcuate it either increases or decreases the appetite. So arcuate is concerned with the appetite. Then moving on to the paraventricular nucleus, PVN, it causes the oxytocin release, the satiety, the HCTH, and also the beta lipoprotein, pressure, and blood pressure. So there is oxytocin release, there is satiety, the ACTH and the beta lipoprotein, and the blood pressure. Next we move on to the medial preoptic and the anterior hypothalamus. Medial preoptic and the anterior hypothalamus. So here the body temperature regulation takes place. The anterior it responds to cold. A is for H, that is anterior is for the hot, that is a heat, and posterior it responds to the cold. Next there is also the presence of the sweating. Now we move on to the supraoptic. So here in supraoptic it causes the vasopressin, and then we move on to the preoptic. So here in preoptic it includes the FSH and also the LH via the GRH. So FSH and LH via the GnRH. Then moving on to the anterior hypothalamus, it is the osmoreceptor. So what is the osmoreceptor? It is the anterior hypothalamus is the osmoreceptor. Then comes the lateral hypothalamus. Lateral hypothalamus, it includes the hunger as well as the thirst. To learn and grow daily like this, please do subscribe.